All right, Thursday's the time we always set aside to talk with members of our medical community. Today we're going to talk about arthritis, something that affects millions of people. So here today to talk with us, Dr. Guy Fiocco with New Hanover Regional Medical Center's Physician Group of Rheumatology. The statistic to me was about 52.5 million people suffer from this.
That's right. It is the most common cause of disability in this country, but not only 50 million adult Americans have arthritis, but 300,000 children have some form of arthritis.
So it is not gender or age specific then?
It is not. And that's one thing we'd like to get across, that even children can get arthritis.
Yeah, because you always tend to hear as you get older in life, that's when
Right.
Doc, the elbow's killing me. It's not getting better.
And that's related to osteoarthritis, which is the most common form of arthritis. And eventually we'll all probably have some degree of osteoarthritis. But as I said, there's over 100 different types of arthritis that you can have.
Yeah, I know, from watching the TV, and you always see the ads, Phil Mickelson. Psoriatic arthritis.
Exactly.
I hear that all the time. And when you break them down, just the generalizations of the differences in those. I know you said that there are so many different kinds, but when you hear psoriatic and you hear rheumatoid and osteoporosis, what are the differences there?
So we group them into, there's one called inflammatory arthritis. So rheumatoid arthritis, psoriatic arthritis, something called ankylosing spondylitis are the inflammatory types of arthritis. There are infectious types of arthritis, like Lyme disease. There are types of arthritis that come with metabolic problems, like gout. So if you have too much uric acid in your system and those crystals end up in the joints, it'll cause inflammation and cause gout, which is another kind of arthritis.
And the good thing is that the majority, treatable.
Right. There's been a lot of advance in the treatment of the inflammatory types of arthritis. Unfortunately, the osteoarthritis, which is the most common, we haven't made as much of an impact in treatment as we would like to have had.
We were kind of speaking during the break about, I was asking the doctor if once you have arthritis, do you have it for the rest of your life? And you're saying that that's not really the case.
So it depends on the type of arthritis again. So if it's an infection, we can usually clear the infection and get rid of the arthritis. If it's gout and there's a metabolic reason, we can correct those metabolic errors and fix the gout so it doesn't come back. But if you have rheumatoid arthritis, we don't have a cure. We have treatments now that can put it into remission, and you might not have much trouble with it, but we can never say that it's gone permanently.
When someone might be at home with a sore shoulder, sore knee, what do they really want to look at as, these symptoms are probably bad enough that I do want to do something?
So if the pain in or around the joint is lasting more than a few days and you can't use the joint because the pain is so severe, that's certainly a time to come in and get evaluated.
And how easy can this be treated?
So it depends again on what it is. You might have pain around the joint, but it's actually a tendinitis and it has nothing to do with the joint. That's easily treated. So we have anti-inflammatory medications to take the pain away. Sometimes we can inject the joint or the tendon to take the pain away. So those types of problems are definitely treatable. Okay.
And I always, the ending to this is always, if you're at home and, dear Bob, my shoulder, you don't want to tell me. I can't help you. You always want to go to the doctor if you have a question about your medical condition. Doc, I appreciate the time this morning.
You bet.
We're back with more after this.